Hello and welcome. So, feelings. How you feeling? Feeling? Oh yeah, I feel. How you feeling? You all right? Now, a lot of the time, people ask, how you feeling? And a lot of the time, we don't know how we're feeling. There are so many different emotions, and sometimes we just can't put our finger on how we're feeling. Now, this can become quite tricky for some people because when we don't know how we're feeling, we don't know what to do. It can make us feel really, really stuck and feeling like we're hopeless. It can make us feel really trapped as well. And then on top of that, we don't know what to do with ourselves. A lot of the time, if we don't know how we're feeling, we don't know where we're going to get help from because I don't know what help I need because I don't know how I'm feeling. Now, when we come down to getting help for our feelings and emotions, a lot of the time when we're not feeling quite great, people do often think that, this is just life, life, we don't always feel great. And that's right. And that's true. But that doesn't mean that we have to go through life feeling like this by ourselves. No, this is what counsellors and therapists are for. Now, when we talk about counsellors and therapists, they don't really have a good reputation. Well, I'm one of them. We don't really have a good reputation. And that's not because the work that we do isn't helpful. It's because of the stigma that is attached to counselling or to therapy or to the word mental health. I'm not crazy. That's what everybody straight away goes and thinks. Now, counselling and therapy, these are ways of helping. You don't go and have counselling and you don't go and have therapy because there's a major problem. And that's what everybody has learned to think about counselling and therapy, that there's a major problem, that there's a big mental health problem. No. Prevention is better than cure. And we don't want you to get to the point of being hospitalised. And I think this is when people think about mental health, that's what they think hospital. We don't want people to get there. We don't need to suffer with anxiety, depression, low mood, panic, worry, phobias, self-confidence, relationship issues, and the list goes on and on. Imposter syndrome, not feeling good enough, self-esteem, and the list goes on and on. And I could keep going on and on. And that doesn't matter how old we are, whether we're young people or whether we're old people. Now, when we're talking about young people, this is why I absolutely love working with young people. Because unfortunately, we're not taught about how our mind works at school. How many wives Henry VIII has, which, how is that helping? It's just not. And we're taught about, everything else, but we're not taught about our minds and how we work as people, which is the most important thing. If you think it, we're like a puppet on a string to our mind. If our mind ain't working right, I'm not doing anything. I don't have any motivation. All right. You're gonna procrastinate. You're not gonna feel right. All right. You're gonna get a little bit antsy or whatever it is that we experience. We all experience our emotions in different ways. So when we think about coming for help and support, going to see a counsellor or going to see a therapist, it's not because we've got something seriously wrong. No, it's about maintenance. It's about staying healthy. It's about keeping on the right side of our mental health, okay, rather than letting it get to a point where we're then reliant on the health system or medication or whatever it might be. Yeah. So we want to help you get there, get to your goals before it's too late. So what's the difference between counsellors and therapists? Really, really good question. And I'm also going to bring in coaches in this and motivational speakers because often we can all get mixed up. Now, psychologists, counsellors, and therapists. Psychologists, counsellors, and therapists, they have gone through, like myself, I'm a psychotherapist. So And you have psychotherapists, you have psychodynamic therapists, you have humanistic therapists. What that means is just a different type of treatment, okay? We're all kind of treating the same thing and all have the same goal of helping you to feel great and amazing and helping you to be the best person that you can. But each approach does it in different ways because we all realize that not one thing fits everybody. Some people are more visual learners. Some people like to just get on and do things. Some people just want to have a chat. So these different types of therapeutic treatments offer that flexibility in how you are treated. Now, when you talk about counselling, this is where people might have kind of long-term treatment. They might see their counsellor for, 6, 8 months, a year, 2 years, 3 years, ongoing. Now, when people go and see a counsellor counselling is a very explorative type of treatment and way of working. So when you're with a counsellor, you're just kind of making sense of kind of what's going on. You're going to do kind of a lot of talking. Your counsellor won't do that much talking. They're going to act more of a mirror to you, as to you. So they're just going to kind of make you just kind of think about what it is that you're kind of saying type thing. They're not going to kind of guide you and give you concrete information or tools. And this way of working can be really, really helpful if people kind of have gone through a lot of traumatic experiences or, bereavement. Counselling can really, really kind of just help them just to kind of make sense of kind of what's gone on. And when we think about that type of way of working, young people are supported in that type of way, in that kind of reflective way, within CAMS. So they are seen by counsellors who help them to kind of reflect on how they're feeling and kind of what they're going through. And within the CAMS service, and this is young people and adolescents mental health services, CAMS, within the UK. So they will work with they will do that counselling type of way of working, and they will also work in a systemic way of working, which is a really helpful way of working with families. And when we think about a systemic way of working, the practitioner looks at kind of core patterns that are developed within the individuals and also within the family setting as well. So that's counselling. Now, when we think about psychotherapy, now this is my area of expertise that I work with a lot, although I also do have counselling skills as well. But I work for the NHS, and largely we use cognitive behavioural therapy. Okay, or you might hear it being called CBT. But cognitive is just a flashy word for thoughts. So our cognitions, which are our thoughts, behavioural, our behaviours, and therapy, which is an intervention that two people kind of do together, a treatment intervention. Now, cognitive behavioural therapy, this type of psychotherapy, this is a more structured type of therapy. So you're not going to be seeing your psychotherapist for years and for really, really long periods of time. No. Psychotherapy is more structured. It's more, for me, it's more of a thing of, we're going to have a look at what's going on. We're going to give you the tools and the information to help you move forward. So we will explore a little bit where your mood may have, stemmed from, or where this stress may have stemmed from, but it's not something that we're going to kind of pay a big, massive focus to. But you've got to we will acknowledge where that comes from. And then what we'll then do in psychotherapy way of working is look at how that is now having an impact on your life today and how you're doing things today, how you're thinking today, how you're processing information, how you're talking to yourself, how you behave, how you approach things and situations, how you deal with things, all right? So it starts to look at where you've been and what you've been through, how that might be having an impact on where you are today. And then what we then do is look at your goals. We think about your goals, what you want to get out coming out for help and support. And then we then start to have a look at the small little changes that we can do in order to get you towards your goals. So CBT is a change therapy, okay? It really, really, I've been working with cognitive behavioral therapy now for over 12 years. And I have seen it change people's lives immensely, okay? Literally, some people, it's like night and day. What can cognitive behavioral therapy help you with? A whole list of difficulties, And when I say difficulties, we are all human. We all have difficulties. You, me, the Queen, Beyonce, all of us, because you're human. Okay. So, it's when we think that, nah, I don't have no difficulties, that's actually when problems will kick in, because we all have difficulties. And once again, I'm going to come back to therapy being something that's reflective, and we don't need to have a really big difficulty. It's about helping us to be and feel the best that we can. All right. So this can help with low mood or depression, anxiety and worry, sleep, self-confidence, procrastination, motivation, panic, phobias that we might have, from spiders to flying, claustrophobia, OCD. And when we think about OCD, which stands for obsessive compulsive disorder, we're always when you think OCD, you think cleaning, don't you? Someone always washing their hands. OCD is a lot more than just someone flicking off the lights on and off, or cleaning excessively. But I'll do a specific video on each of these treatments. But these are the things that we help with post-traumatic stress disorder, which is when someone has been through a traumatic incident, they might be left with post-traumatic stress disorder, PTSD, you might have even heard it. And, sometimes it's really hard for people to identify what their experience is, because they don't know what it is. Because once again, we come back down to, we're not taught about these things. Some people have really, really bad sleep, really, really bad nightmares, and they've been through something in the past. It could be 10, 15, 25 years ago. And they don't actually realize that, my really bad sleep and my flashbacks, that's PTSD. And they might think that they're going crazy, or, they're weak, or this is just how life is for them, No, it's not like that. So, I always would prompt somebody at some point to attend a therapeutic session with an accredited therapist like myself, as a just a reflective tool to help you to become the best that you can be, and just to help you to reach your goals with the least amount of distress possible. The least amount of stress possible. Some of us are professionals, okay, in high powered jobs, got mortgage, got big car, you're really, really doing things, got family, got the husband. But sometimes we still just don't feel ourselves. And a lot of the time, when we do find ourselves in these high power positions, and when you get to a certain point, that you often feel like, it's just all on me, I've just got to just keep going, and you feel like it is all on you. I was watching a Chris Rock. He's a comedian from America, the other day, and in his recent comedy video, he talks about having a mortgage, and I was absolutely creasing. But the pressure of a mortgage, and that you can't move because mortgage, and you've always got to think about the mortgage. And sometimes these things can really make us get stuck, whether it be the mortgage, whether it be because we've got the kids, or whether it be because that's the job, or whether it be because we don't feel that we have the right qualification or skill, or even just the confidence, to do certain things. This is where therapy comes in. and becomes really, really helpful from getting you from there to there. Okay, and it's not because you're crazy, or it's not because you're weak, or none of those things. It's just because you're human, and we all have blind spots. So let a professional help you identify your blind spots and help you put a mirror there so you can see, help you put the right tools in place. Now, before I go, I just want to talk about motivational speakers and coaches and how they differ from counsellors, psychotherapists, and scientific professionals. Now, I love me a Les Brown. Okay. I love me a Tony Robbins. Okay. I love them. And over the years, I have spent a nice bit of money attending coaching sessions and engaging in motivational talks and groups and weekends, because this is a really nice way of maintaining one's mental health, okay, and kind of keeping on top of things, learning new things, because things are always evolving. The scientific world is always changing and evolving. We learn new things so we can share more with the people that we work with. And it's the same within the coaching in the motivational world. New techniques, new things are learned. So it's really good to attend those types of events. But what they are not going to help you to overcome that distress and that difficulty long term. Now, after you attend a motivational event or you go to a coaching session, you might feel great for a couple of hours, days, weeks even. Get back home, you're like, right, I'm on it, I'm going to do this. And you get on it and then you get off it again. Yeah, I've done it as well, me too, yeah, because I'm human, just like you, okay? And what happens, we have all the best intentions. The feeling is there. We know what we need to do. Yet, we get to a point where it tapers off and it tapers down. And we find ourselves slipping back into old behaviours and old patterns. And then we attend the next one. Spend a few £100 or a couple of grand, whatever it might be. Okay. And I'm not saying that these people aren't worth their weight in gold, because they are, at the right time, as a form of maintenance. However, when we keep finding ourselves back in the same pattern, which what that then leads us doing, after we go to motivational talk and after motivational talk, we then start beating ourselves up even more because we've spent more money and we're still feeling the same way, or it hasn't helped and we're still feeling the same way. That's because we're getting the wrong support. We need to go and get professional treatment, okay? This is where psychotherapy comes into play. It helps you to identify core patterns that only a scientific professional is going to help you move, shift, and identify. Because coaches and motivational speakers, they deal with things like on this level here. Yeah, they feel good. Yeah, right there. Therapy, it deals with things here. Okay. We need your head and your heart together. By the time you finish the motivational speaking thing, you're like, yeah. And then it goes back down because the heart and the head are not talking. All right. After therapy, and you've finished engaging in therapy, this is where the head and the heart start to meet, and we start to make real long-term changes. Guys, thank you. I'd love you to share this video. I'm new, so I'm really, really looking for some support. I specialize in helping young people become the best that they can be. And that's because I believe the children are our future. Thank you. Please subscribe and Have a great day. Bye-bye.